The aim of this video is to discuss ways in which healthcare professionals can support patients who may be resistant to mouth care to maintain the best possible oral health whilst in hospital. Mouth care is an essential part of a patient's personal care and includes toothbrushing, removing oral secretions, dry mouth care, and denture care. Many patients in hospital will need support from a healthcare professional to maintain a clean and comfortable mouth. If the patient does not receive regular mouth care, it'll have a consequence on their overall health. The mouth can become dry, sore, and uncomfortable, and this can impact on eating, speaking, confidence, and overall well-being. One of the most common barriers reported by nurses when providing mouth care to patients is care-resistant behaviour. This can be common in people with a cognitive condition such as dementia, learning disabilities, or a neurodisability. Care-resistant behaviour is when a person opposes the action of a caregiver. In terms of mouth care, this can include not opening the mouth, pushing the carer away, or verbally declining mouth care. There are many reasons why patients in hospital may be resistant to receiving mouth care. They may be confused and disorientated, or be in pain and feel unwell. They may perceive the action of toothbrushing and having another person look in the mouth as a threat to them. Resistance is their way of protecting themselves. Unfamiliar faces, timings, location, and different approaches to mouth care may feel very threatening to an individual. If the mouth is already dry and sore, mouth care may be more uncomfortable and also contribute to the person resisting mouth care. All patients are different, but there are ways healthcare professionals can support these patients. Some tips for delivering mouth care if a patient is resistant. Taking time, being kind and patient, smiling and making eye contact while maintaining communication throughout is essential. Use short sentences with simple instructions, perhaps using reminders and prompts, such as placing a toothbrush in front of a patient or putting it in their hand or applying a little toothpaste on their lips can act as a reminder. Develop a routine, providing mouth care at the same time each day, or try and find a time when the patient is more cooperative with personal care, for example, after breakfast. Try and use toothbrushes and toothpaste that the patient is familiar with. Make sure that the patient is sitting up where possible to reduce the risk of aspiration. Face the patient so that they can mirror and mimic your actions. Let them hold and feel the toothbrush, or gently brush their hand as reassurance that it is a toothbrush and not something that may hurt them. Using the hand-over-hand technique, place your hand over the patient's hand, guiding the patient to brush their teeth. Distraction may help with compliance or calm the patient. This could be singing to them, talking to them about something they're interested in, or having a favourite TV or radio programme playing. Asking a carer or family member who's more familiar to the patient to help with providing mouth care. Having two people can be useful. One to distract or gently hold the person's hand while the other cleans the mouth. Some patients may be very resistant to mouth care. It's important to stop and record that the patient is not compliant and try again at a different time. If a patient refuses mouth care on several consecutive attempts, this should be escalated to a senior nurse or their medical team, as there may be an underlying problem with their mouth. Mouth care is an essential part of patient care and contributes to dignity and well-being. It's important that when patients are resistant to care, we try and find ways to support them and document this in their care plans.